Assalamualaikum warahmatullahi wabarakatuh. Hello, my name is Waskitho. On behalf of all my team members, today I want to present my presentation entitled Correlation between Temporomandibular Disorder or TMD and Systemic Disease in Kulon Progo Regency, Indonesia. As I mentioned before, me, the team leader, Waskitho, and all my team members from Faculty of Dentistry with the program title is Temporomandibular Disorder and their correlation with systemic disease. The program scheme is EPM Muhammadiyah and Aisyah. Temporomandibular disorder is a condition characterized by aberrant, incomplete, or impaired function of the temporomandibular joints with common problems such as influence the masticatory muscle and temporomandibular joint, with the pain also, with the TMG pain and restricted mandibular movement and TMG sound. Many Indonesian, based on the Indonesian National Health Survey 2023, has non-communicable disease or NCDs such as diabetes, with 2.2% is by diagnosis and 11.7% by blood sugar level. And hypertension, it's 8% by diagnosis and 29.2% by blood pressure levels. From this data, there is a gap between the already diagnosis one by the clinician and by the measurement of the survey, which is it means that there is a low awareness regarding the NCDs. And on the other hand, the association between systemic disease and TMD exists. The correlation between blood pressure levels and increased susceptibility to painful stimuli has been documented. Nonetheless, information concerning about non-communicable disease like diabetes, hyperuricemia, and hypercholesterolemia is insufficient. This study aims to evaluate the correlation between TMD and NCDs, especially hypertension, diabetes mellitus, hyperuricemia, and hypercholesterolemia. Methodology. The data collection placed in the Watas Subdistrict, Kulon Progo Regency, province of Daerah Istimewa Yogyakarta in Indonesia. Population is voluntarily patient in the outreach clinic. The inclusion criteria is age more than 15 years and able to read and write. Elderly patient over 60 must be accompanied to minimize the risk. Data acquisition method for temporomandibular disorder, data collected by 4 trained examiners using the symptom questionnaire of TMD, its Indonesian version, and also DC-TMD examination questionnaire, that we combine these 2 questionnaire with the examination, also with we are talking to the patient, we can obtain the diagnosis. For systemic disease, especially hypertension, diabetes, hyperuricemia, and hypercholesterolemia, identified through medical history interviews and also random blood test. We use digital spine manometer and rapid test GCU checker. And the data analysis is bivariate and multivariate chi-square analysis models to evaluate the relationship between the outcome variables. In all models, significant association only with value below P 0.05. All analyses were performed using SPSS software version 29. As we know that the prevalence of the TMD is 45.26% compared to 54.74% in the non-TMD diagnosis. But the correlation between the TMD and the gender is not significant. In the below table, we can see there is a correlation between the prevalence of TMD and NCDs. All have the positive correlation, but the hypertension, it has the positive correlation and also significant value. So we can see that hypertension is more significant than other NCDs. Hypertension, higher BMI, and lower values of mean of SpO2 and higher percentage of SpO2 below 90% constitute independent risk factor for increased bruxism episode index in the previous research. As we know, bruxism is one of the parafunctional activities that are related to the etiology of TMD. So we can see there is a correlation between hypertension combined with higher BMI, and other factors. But there's a contradicting also finding that this patient with hypertension experience TMD tend to have lower rates pain than those who also have a history but do not have TMD symptoms. Although the prevalence data seems lower, the association between the 2 variables is the strongest. There is a systemic disease, which is the hypertension, and also the TMD. We can say that there is a correlation, strong correlation between hypertension and the prevalence of TMD in this population. As a conclusion, this study concludes that individuals who experience a systemic history of hypertension are more susceptible to TMD, and the promotive approach is needed to increase the awareness and people's knowledge so that it's become a behavior. And then meanwhile, a preventive approach is also needed for early detection and prevention of the development of disease. This is the program documentation. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.